Welcome, everyone, to the International Childbirth Initiative webinar series on the 12 steps to safe and respectful mother-baby-family maternity care. My name is Michelle Scartharian, and I'm the coordinator for the International Childbirth Initiative. I'm very pleased to welcome you to today's webinar. Today's webinar is on Step 12, the promotion of breastfeeding and skin-to-skin contact. Step 12 is based on the guidance from the original Baby-Friendly Hospital Initiative for those who are familiar with the original BFHI certification process. So for those who are new, ICI is at its core an implementation and quality improvement process that strives to achieve the 12 steps for safe and respectful mother-baby-family maternity care through a self-evaluation and reflective process at the facility level. ICI is also a global resource network of facilities who strive to share their learning and to improve the provision of care. ICI was created originally through a joint effort between the International Federation for Gynecology and Obstetrics and the International Mother-Baby Childbirth Organization, IMBCO. ICI now includes 23 partner organizations and is continuing to grow, and we are open to all birthing facilities who are willing to commit to delivering safe and respectful mother-baby-family maternity care. Our first presenter today is Meena Sobsamai. She is a nurse midwife, childbirth educator, and lactation consultant at Samitivej Sukhumvit Hospital. She is also a volunteer for CBFT, the Childbirth and Breastfeeding Foundation of Thailand. Our second presenter today is Dr. Asha Bennekappa. She is the professor and head of the Department of Pediatrics at Dr. Chandramma Dayananda Sagar Institute of Medical Education and Research in Horahali, Ramnagara district. She is also the founder and trustee of the Lactation Helpline, which since its inception in 2005 has been helping mothers with issues no matter how small or large by telephone in what is now a teleconsultation service. She is also a healthcare practice task force member for 3 terms for WABA, the World Alliance on Breastfeeding Action. And with that, I am very pleased to present to you Meena Sobsamai.
Good morning, everybody. I'm very happy to come and share with you. And thank you, ICRA, to invite me to join this webinar. Today, we're going to talk about step 12, which is promote breastfeeding and skin-to-skin contact, referred to the 10 step of Baby-Friendly Hospital Initiative, and integrate it to practice, training, and the policy. What is all about the 10 step is immediately skin-to-skin contact between moms and baby, and early initiation of breastfeeding. And both of this is closely to how birth happen. Then it means that when birth happen naturally, no intervention, moms and baby are fully awake and ready to start everything on their own. But if the birth have a lot of intervention or even some intervention, they might affect this process to happen. We hope that we can encourage this 2 important practice to happen to every moms and baby. Right, next slide. The 10 step of Baby-Friendly Hospital is something that you can see in the ICIchildbirth.org websites, but I will mention the 2 main things that we should think about. The first 2 steps of the 10 step is mostly involved in the policy. Then this means that when moms and babies are in the hospital, or when mom's going to give birth in the hospital or health facility, the 10 step will reassuring moms to have a support that give her a success of breastfeeding easily. Then this is the 10 step is working forward, and it's mainly in the hospital. The first 2 steps is the policy, which is including code monitoring. The second step is train the staff to be able to facilitate the policy to be in the practice and make its monitoring and control it to make it happen again and again, as long as the hospital still have intention to support breastfeeding. The rest of that is the clinical practice, keep moms and baby together, start immediately breastfeeding, no supplementations, and to the step 10, which is like access to the community support. which is very meaningful to the success of the breastfeeding. Then when we talk about the 10 step of baby friendly, it means that we try to create the environment that support moms and baby to be success in breastfeeding whenever they love to or whenever they want to continue. And it's like take a village to raise a child. It's also take a village to promote, support natural birth and breastfeeding. And I will go to more details about the 10 steps of baby-friendly hospital later on. Okay. The step 12 of ICRI is promote breastfeeding and skin-to-skin contact by following the 10 steps of revised baby-friendly hospital, which is the newest one is the 2018, which is try to include our code of marketing and the way we perform of support to moms and baby are to have a more positive outcome. To protect, promote, and support breastfeeding in facility, which is provide maternities and newborn care is mainly number one, breast milk only, unless medical indicated. Number two, which is second important, rooming in and skin-to-skin contact. Number three is help mom to recognize and respond to their baby feeding cue, then they can do it later on. Number four is not just only breastfeeding, we have to give them the information regarding to use of the feeding or utensils, a bottle or teat, both rich and benefits. Then they will think carefully before they choose to use it. The last one is very, very important, is coordinate discharge. We have to make sure that before mom's going back home, she know a little bit of how to manage breastfeeding. And she know where to get help if she need to. This will be something that help mom carry on her breastfeeding or as long as she wants. Next slide, please. The implementation of skin-to-skin contact is very meaningful to moms and baby because it's a transition period or the going out from mothers to babies, from woman to a mothers, from fetus to newborn. Then it is very helpful and very important to help make sure that everything happens nicely surrounding with the support environment. It's not mean that we put the baby back up to the chest and lift them, but it means that we support mom to have a very nice comfort to hold her baby because her body was responded by the oxytocin who contract the uterus, make her body warmer, ready for the baby to welcome them in a nice environment outside the womb. Then this should be happen without restriction as long as moms and baby want to, and immediately after the baby born. This is the key. Then method or the way we give birth is meaningful to make it happen. And all that 10 steps will not be happen if the team not work. I will show you a little bit about the 10 steps in the hospital facility that happen in my practice and in some others hospital. The 10 step is including inform moms and baby before they have a baby at the prenatal period, because this is the time which is very important to make or give her the information to be ready and know a little bit more of breastfeeding. The other way is we give her the heart to do it with her heart, because I mean, information only doesn't mean much to encourage the people to keep going. Then after we give her the information about importance of breastfeeding and how to solve the challenges that may happen during breastfeeding, we might have to encourage her to have a positive attitude to be ready to help the babies breastfeeding as long as they want. Then it means that class prenatal education activity, breast examination we do at the prenatal class or a prenatal visit at the ANC. Once the women are giving birth, the labor ward or birth room will help initiate breastfeeding right away and support the breastfeeding in the early hour during their stay in the birth room. This will help mom feel secure and ready to just start it. And she will feel the attachment between her and her babies, and this will help her to continue as much as she can. Once the moms and baby move to the postpartum ward, some hospitals have one maternity unit, including the people who care babies and people who care moms. Then that is a midwife. Some facility have a separate unit like nursery on the postpartum staff. But anyway, they have to work together because moms and baby is one unit that have to work together as a team. What they are doing if our nursery start home, nursery will help continue breastfeeding, reassuring the baby have a good latch and sustaining and improving milk supply. For the postpartum start, they need to help for breast care and improve milk supply because sometimes they need a little bit of like advice or health or practice. Then both of them have to work together to help make moms are capable to do it basically, or some are challenging that may happen during this time, like nipple pain or something like that. They need to know how to manage it. Then they make a discharge plan. They plan to get access of well baby checkup and or access to community support when the babies and moms go back home. And after that, it's not finished yet because breastfeeding should exclusively breastfeeding should be continued until 6 months of age. And after that, they have to continue breastfeeding together with the solid as long as they're 1 or 2 years or beyond. Then well baby clinic and lactation clinic will be an important part to help support moms and baby keep going. Well baby clinic usually support in the first 7 days, 1 month, and 6 months to make sure that the first 6 months exclusively breastfeeding can happen as much as we can help. And 2 years or beyond is the next target that well baby clinic should encourage moms and baby to do so. For lactation clinic, it should usually it is for the cats that needs extra or care or advice, then they can come and stop by or even visit them later on to help continue support wherever the babies and moms need us. And this is the pictures of how the team work. They cannot do just their own, not only ANC, not only birth room, not only the postpartum staff, but they have to send and continue the care as long as the baby's growing. Right. Then there is a lot of evidence to say that what kinds of practice that helps stimulate breastfeeding to continue, what kinds of practice that interrupt breastfeeding, which is, the more we support, the more we start. It's very helpful to continue. And information from moms cannot be delayed. She need to know beforehand, not when she have a baby, because at that time she's forgetful because of the hormone working. There is a lot of exciting and easy to forget. Then if we give the information regarding to what she needs to know beforehand, then it's easy for her to just pick it up and slowly practice, not too much nervous. Then we hope that all this will help us to know which part of our job that we have to emphasize. The first breastfeeding is meaningful again. There is no evidence to say harm. That is mean that please make it happen. Unless some indication happen if like the baby are born by C-section or something like some other condition. Whenever ready, we should start it right away. And to promote breastfeeding and skin-to-skin contact, it's like what we said before, no culture no critical period during the first breastfeeding. It can be as long as moms and baby want. The more we allow it to happen nicely without interrupted, the more it's nicely happen after that's 2 hours or when they are together. That attachment happen during this time. Yes, and in the other way, if we interrupt breastfeeding or supplement, sometimes we not feel that much like problem. But in fact, there's a lot of studies saying that the hospital who supplement breastfeeding, we found that moms who were supplement have more cessation of breastfeeding in a very early month, more than those who have no supplementation, because supplement make the woman lost the confidence to do. Then what we need to do to help the woman can carry on is encourage, empowers, and cheer her up to make it as happy as she can make it. Then I will show you a little bit of how we do it, because breastfeeding is a continued process from birth, babies, and breastfeeding. Then it should be continuing of support from pregnancy to childbearing years. Encourage is mean that we like to make people feel good and do it by heart. It's not because they have to do, but it is because they love to do. They know this is good for their baby. They know this is good for themselves. Then they will happy to make it. Then everything should make it very nicely, not try to make them stressful, or they have to do because many people around them do it. But they have to do it because they feel like, I will try, whatever it is, I love to do it. Then what we are doing in the hospital, there is 2 facilities which is different. The first one is from Phnom Penh in Cambodia, where I has been our advisors for years to start breastfeeding. Because we feel the importance of the staff who deliver the care to moms and baby. And these people have to be encouraged and empowered and make them feel good to do it. They feel they're important. They feel that we are part of successful. Then we train them the clinical practice, they train them the theory, and we try to help our more like our positive thing. Then the word of encouraging breastfeeding will be everywhere, like a tag, poster, and everything surrounding the maternity ward or ANC. Everyone will see the word of encouraging. To empower moms and babies is empower their families. Then when we do the class for moms and baby, we bring all the families together, then they all know. And when they have a baby already, we try to cheer them up, visit them, and give them a nice, like, encouraging word to keep them carry on. Tell them that we will help you forever if you're breastfeeding, then they can come see us. This is the example in the Phnom Penh where they start breastfeeding support. The next is Samitivej Hospital in Bangkok, where I work. This place work for breastfeeding and natural birth for long. Then the way we stimulate or empower will be different. Yes, we train the staff. This is Royal Phnom Penh. Then they are starting. Then everything very conventional, but it's positive atmosphere. The next slide is Samitivej Hospital, where they do it for long. Then when we do the class for staff, yes, we do theory, we do practical thing, and we do more advanced like research, TED conference, more team participate to just like review and do something more then we can carry on. And we try to make a level of senior staff to help the new one. We do intensive course, and this staff will help us to just like training the young staff. Or for the size of moms and baby, we do a class which is very cheerful, which is very relaxed. We can sit everywhere, we can enjoy whatever, and we bring moms and baby who experience of birth and breastfeeding come and share their thought. And this is very helpful. And moms always like to share the experience in community, in the hospital, wherever. They just like to say something about the experience because they feel proud to do it. And for mom who carry on until 2 years or beyond, because we have a World Breastfeeding Week every year, we will use this event to just say proud for all mom who can make it happen and say encouraging people who are coming to stay. We select some influencer or celebrities to come and share the experience and let them share amongst them in those they can work on. Then it is the pictures of World Breastfeeding Weeks, and we put like she's a Miss Moms who proud of 2 years breastfeeding, and then there is a lot of people who would like to carry on and do it, like she said, more and more. And also the staff will feel very proud of support that they give to all of this mom, because this mom very cheerful. They're very happy to do, they're very happy to share. And we hope doing a natural birth and breastfeeding will make people to do it by heart and sharing their good experience forever. And this is why ICI is very important to work on. And this is what I'm going to share with you. Asha going to share with you more information about how important of breastfeeding and birthing that have to go along with.
Hello everyone. I bring greetings from Bangalore. Bangalore is in the state of Karnataka, India. I would like to now emphasize step 12 of the International Childbirth Initiative. Remember that step 12 of the International Childbirth Initiative is step 4 of the Baby Friendly Hospital Initiative. What is the step 12 all about is it's immediate and uninterrupted skin to skin contact. What does it do? It facilitates the newborn's natural rooting reflex that helps to imprint the behavior of looking at the breast and suckling at the breast. Helps to populate the newborn's microbiome and prevents hypothermia. Early suckling will trigger the production of breast milk, accelerate lactogenesis, and establishing maternal milk supply. To overcome not enough milk syndrome, establishment of milk supply is critically important for success with breastfeeding. Early initiation of breastfeeding has proven to reduce the risk of infant mortality. 2007 World Breastfeeding Week theme, breastfeeding the first hour saves 1 million babies. Remember, just that one act saves 1 million babies. Initiation of breastfeeding is a consequence of uninterrupted skin to skin as a natural behavior for most babies to slowly squirm or crawl toward the breast. All mothers should be supported to initiate breastfeeding as soon as possible after birth, because immediately after delivery, the woman probably cannot get up and take the baby and put the baby to breast. This is where Ray Davis' favorite concept of doula comes in. And also, I have been advocating about the birth companion or a lady birth attendant by the side of the mother to help this happen. Colostrum is the first milk the newborn consumes immediately after birth, is highly nutritious and contains important antibodies and immune active substance. The amount of colostrum the newborn receives in the first feedings is very small and a relatively unimportant factor. But early suckling is important for stimulating milk production and establishing maternal milk supply. What does immediate skin to skin contact do? 2 hours after delivery, sensible vigilance and safety precautions should be taken so that health professionals can observe for, assess, and manage any signs of distress. Close observation for mothers who are sleepy or under the influence of anesthesia. Immediate skin to skin care and initiation of breastfeeding is feasible following cesarean section with local anesthesia and also following general anesthesia. The initiation can begin when the mother is sufficiently alert to hold the infant. Health professionals, doctors, friend or family member should accompany the mother to prevent the baby from being hurt accidentally. This is where I also have a concern that the cots, the labor ward cots, should be mother friendly, a little broader, and the height also should be a little lower. In settings where national authorities recommend breastfeeding for HIV positive mothers, they should also follow this recommendation for skin to skin and initiation of breastfeeding and breastfeed exclusively for 6 months. I did a project of studying of existing staffing of labor ward nurses with specific reference to their role as birth attendants is what we call them. Now in India it has been redesignated as birth companion and in the rest of the world it is doula concept. So I found that the labor ward nurses were absolutely helpless because they were very busy cleaning the perineum, discarding the placenta, and documenting. They frankly agreed that they are not doing anything with regards to skin contact or putting the baby to the breast. Following this, one of my publication is Role of Female Birth Attendants to Enhance Breastfeeding Rates and Essential Newborn Care. So this was published in the Indian Journal of Child Health. What is this all about? Every time a pregnant mother comes to the hospital, she is accompanied by a female person, or in the rest of the world, it could be a male companion. Whoever it is, you should start motivating them, giving them the concept of what is skin to skin contact. Remember, all this happens immediately after delivery. So we really don't have time to train or teach them at that point of time. And Meena had been talking about it, about the antenatal period and what they should do in the nursery and the postnatal ward. So it's very important that the whole process starts right at pregnancy. I want everyone to know and keep this picture in their mind that the newborn stomach capacity from day one to one at the end of 1 month, it's a gradual process. So the milk that is available in the first 2 hours of birth may be very little, but remember it's the beginning of a situation where the mother will secrete more and more milk as the baby starts sucking and the stomach capacity starts increasing. This is a story to tell you that breastfeeding is all about confidence trick. So we have to train the mothers on counseling skills is very crucial. This was a mother who was working in a garment factory. She was a victim of a dowry harassment where the husband threw kerosene on her. She managed to save her breasts and she also managed to put the baby skin to skin. So all this was possible because of the confidence she had following counseling. So counseling is very crucial in initiation and establishment of breastfeeding. And this is skin to skin contact in a baby. You can see that the back is covered, but inside that the baby's skin was with that of the mother in a low birth weight baby and a preterm baby. This is after she was shifted to the kangaroo mother care ward. This is an example of a baby put to breast within 1 hour of birth. If you look at the picture closely, the expected skin to skin contact in toto is not happening because the trust the mother has owned to the labor ward, we are having difficulties in putting the baby skin to skin contact. Remember, it's a bare chest of the baby on the bare abdomen of the mother. From the abdomen, we shift the baby to the chest, and in between the chest, we put the baby there. And also, the temperature of the lactating breast is 38 degrees centigrade, similar to the temperature in the amniotic fluid. And the baby finds it very comfortable. So I insist that the dresses that mother's way to the labor ward should be comfortable to put the baby skin to skin contact with probably a nice cover at the back. When mothers or infants are medically unstable following delivery, or support them to breastfeed as soon as they're able. So, we make a rule and say it should happen within 1 hour, but there are some times when it can be delayed. But even then, it does not matter. You should ensure that it should happen in the next few hours. What happens when the baby is put to the in skin to skin contact? There are advantages both to the mother infant dyad. There is an earlier expulsion of the placenta. The moment the baby starts nibbling at the breast, remember the nipple and areola become hyperpigmented in the last trimester of pregnancy as if to guide the newborn to its source of nutrition. And also, the length of the umbilical cord is 18 inches long. It is a distance from the vagina to the nipple. The moment the baby starts nibbling at the breast, oxytocin is produced, which contracts the uterus, expels the placenta, and reduces bleeding. Increased breastfeeding is self-efficiency, lowered maternal stress levels, rise in the mother's oxytocin during the first hour is related to an establishment of mother-infant bonding. What happens to the baby? It decreases the negative consequences of stress of being born. Whenever the mother is doing the bearing down pains or labor pains, during that time, there's a catecholamine surge, the stress hormones that pass from the mother to the baby. And the mother and baby are alert and active in the first few hours of birth. That's why the emphasis on skin to skin contact in the first hour. And once the skin to skin contact is established, the little baby is, there is stress is reduced. There is a more optimal thermoregulation continuing even in the first day, less crying. And it's just not this. There are long-term benefits of skin-to-skin contact. We are going through a lot of global pandemics, globacity, non-communicable diseases are on the rise, and a lot of issues with adolescent children. But remember, the skin-to-skin contact has just not giving us beneficial at birth, but also continues to benefit in the life cycle of the mother and infant. The skin-to-skin contact provides the initial colonization of the newborn's microbiome outside of the mother. The microbiome colonization begins before birth and continues through the birth canal. Hence, do not bathe the baby immediately after birth. The first taste of colostrum will provide vital sustenance to the infants, developing gut microbiota inflicted in the expression of genes. These optimal microbiome has been implicated in long-term health, including decreased obesity and the metabolic diseases. In otherwise, it is called as non-communicable diseases like cancer, obesity, hypertension, etc. Skin-to-skin contact is linked to self-regulations, a part of the concept of self-control and improved mother-infant mutuality year later. Self-control at the age of 4 years has consequences to adulthood in terms of decreased drug addiction, criminal behavior, education, and income. Helps in parenting by protecting against parental roughness, decreased child maltreatment, and laying a foundation for the child's self-regulation and self-control. Preterm and low birth weight babies too can be put on skin to skin contact, and it is particularly important because if these babies have to go healthy, you remember that the brain is developed to 71% in intrauterine life, and the rest of the brain grows up to 85% in the first 3 years of life. And by putting this baby skin to skin contact, we are establishing that elixir of life, breast milk, which is so important for the development of the brain, all the more in this preterm and low birth weight babies. So kangaroo mother care involves early, continuous, prolonged skin-to-skin contact between mother and baby. Main mode of care as soon as baby is stable. Wait, what do I mean by baby is stable? Absence of severe apnea, that is, the baby's breathing is all right. They should not be decreased in the decreased heart rate. And when you look at the oxygenation, and it should be above 95 saturation. So benefits in terms of survival, thermal protection, and initiation of breastfeeding. Preterm and low birth weight baby, what is the position? Firmly held and supported on mother's chest between the breast with the mother in a semi-reclined position and supported. Preterm infants may be able to root attached to the breast and suckle from as early as 27 weeks of gestational age and stable. Early establishment may be difficult if sucking reflex is not yet established and mother's secretion not yet plentiful. Early and frequent milk expression is critical in stimulating milk production and secretion for those who are not able to suckle. The aim is transition to direct and exclusive breastfeeding and is facilitated by prolonged skin to skin contact. So, what is the take home message? Skin to skin contact in the first hour of birth and early initiation of breastfeeding has benefits to mother and baby. Preterm and low birth weight babies also benefit, and there are long term benefits in prevention of morbidity and mortality. I take this opportunity to thank my friend Ray Davis. We both worked together for almost 3 terms for the WABA, that is World Alliance on Breastfeeding Action, as task force members of the healthcare practices. My sincere thanks to Michelle and also to Meena. Thank you very much.
Thank you so much to both of you. Those were fantastic presentations. So for the Q&A, we just have a couple questions for you. You can take turns answering, but we are asking all of our presenters to give their thoughts as the facilities are moving through the 12 steps and considering and evaluating. We'd like to know why you would say that step 12 is an important one amongst all the material that is.
Yes,
Yes.
For me, it is because when we do every step for moms and baby, we just like to see the outcome of healthy baby and healthy mothers. And healthy babies and healthy mothers need continuing of care by breastfeeding, because breastfeeding is not just only food. It's more than a food. It's security. It's health transition for moms and baby. It's immunity. It's protection. Then if healthy baby did not receive the breast milk, they will not be as best as they should be. Then if good birth happen, or if any birth happen, breastfeeding should be following. And then exclusively breastfeeding is meaningful to health of the baby. Then step 12 is very, very much important of the outcome that we are looking for.
Just the simple act of skin to skin contact has lifelong implications in terms of health of the mother and the baby. Meena already told us it is not just the nutrition, it is emotional, it is long-term effects. Now we have a lot of issues globally. Non-communicable diseases are on the rise because babies are not fed with breastfeeding. The earlier steps of the first to 11 steps of the International Childbirth Initiative are very much oriented to the mother. But here we are talking about the mother and the baby, and through the baby, the community and humanity. When we look at it like that.
Thank you. Yes. And another question we have for you that comes from some of our sites is there are some physical challenges and barriers to achieving skin to skin and initiation of breastfeeding with the structures of the facilities and simple logistical challenges. So what would you say are the barriers that need to be overcome, and what are the factors that would enable it to make it easier to achieve skin-to-skin and initiation of breastfeeding? Go ahead,
The
Asha.
first and foremost component of that skin to skin achieve, or if you want to achieve that skin to skin contact, is the labor ward gown. You know, wherever the mother is delivering, she should have a proper gown. So when the baby is delivered, we take it out and the baby can put skin to skin contact. We said no clothing between the chest of the baby and chest of the mother. So please ensure that the mother wears a gown, labor gown, that is very comfortable to put the baby to the breast. So when the baby is onto the breast, the gown should come and cover at the back of the baby. So it's a double one. You don't have to have another blanket to cover the baby at the back, because we're concerned about the back portion of the baby too. The second most important component, Michelle, is that look at mother friendly labor cots. You know, the labor cots are not at all mother friendly. They are narrow, they are at a height. We stress her a lot. So I would like all of you to take it at a global level of a comfortable mother friendly cots. These are the two most important barriers. There are multiple barriers, but the most important barriers for skin to skin contact and establishing breastfeeding would be this.
All right. It's like what the Asha just mentioned. I mean, if the dress and everything is not support the woman to just open her chest, press the baby on, it just like, I mean, you just like change it, okay? Then just think about having a skin to skin contact. How hard it is. It's going to be very easy. Just open and put the baby on and hold. What we have to do as a caregiver is just look at the surrounding and look at the thing that can help support. If the baby are semi-sitting, she can easily hold the baby's cover and enjoy looking around, smile to you. This is a meaningful of memory when woman giving birth, rather than like, oh, it's the ceiling, I cannot see anybody else, it's very stressful. No, not that way. Then it's mean environment of giving birth is very important. If the women are in the environment that cheerful, peaceful, encouraging, full of love and support, this will happen very nicely. Then it means that the intervention or thing we do during birth is something that interrupt this to happen. Then think carefully before you use the intervention, because it's going to harm to both moms and baby. And if you think easily to make something positively to support the woman, you can find something very easy to make it happen. I'm sure you are very creative. You can make it happen.
I really want I really want to push the dola concept. I want somebody from, I don't want an extra hand, and so that we don't, the HR departments may say we don't have salary. Because Meena very nicely told us the antenatal clinic and all that. During such time, the mother is accompanied by a female attendant. Please train her on this just one act of putting the baby skin to skin immediately after delivery. All barriers are broken. The mother is very comfortable with that known attendant or birth companion or doula.
These are
Right.
such,
Can I share a little bit something? Because
of
I
course,
just would like to or encourage people to take a look of how we are in the birthing witness situation, like what we have to stay there. It's meaningful to a babies because it's just one time when they give birth. We saw birth many often, then we not feel like this important. For the baby who birth, they just have one birth experience, and this birth experience with them forever. Then if we are the caregiver or somebody who take a witness part, please make sure that we help this baby have a happy moment, memorable, because it is with them to the rest of their life. Right?
thank you so much, Meena. I don't think we could end on a more important point that you've just summarized. I think everything we're trying to encapsulate in all of the 12 steps. Thank you so much to both Meena and Asha for these excellent presentations today. Thank you so much to everyone who has watched our 12-step videos. We hope that you will watch all of them and learn from them and also interact with us. We will be receiving questions. If you have questions following this webinar, you can contact us at the icicchildbirth.org website. We can also forward questions on to Asha and Meena. If you have specific questions, we will be getting in touch with you and sharing that, because we definitely want to encourage conversation based on this learning and what you're sharing with us today. Thank you so much.
We're well on time.